Okay, my name is Julie Hetza-Harris. I did my second paper on adolescent suicide. So since the 1940s, the rates of suicide in adolescents has actually tripled. There was an increase of 56% in the rates of suicide in children ages 10 to 19 just from 2007 to 2016. For females, there was an increase of 70% from 2010 to 2016. Most of the studies don't focus on race, rather gender and age. However, in a study done, they did find that over 1,600 African-American children committed suicide and over 13,000 Caucasian children committed suicide during that time. When they went further and kind of broke down some of the age groups, they did find some racial disparities. Children ages 5 to 12 in African-American communities who are African-American were 2 times higher to more likely to commit suicide in that age group. Protective factors for suicide, family relationships, having a strong parent and family relationship is a protective factor. For girls especially, having strong friend groups and emotional well-being is a protective factor for all genders, but especially for girls. Adolescents who are involved in a sport of some type, so some type of organized sport, that's a protective factor for them. And then having a high GPA. So in racial groups, especially in boys with high GPAs, there was a decreased risk of suicide for those boys, and that was all races for them. So risk factors, gender and race. So white Caucasian girls are at the highest risk of committing suicide or attempting suicide or having suicidal ideation. Children who live in poverty. Children who have some type of mental health issue, be it depression or other known mental health illness or substance abuse. Those children are over 90% more likely to attempt suicide. Kids who live in dysfunctional family dynamics, so children who are in a foster care system, children who have been abused, whether that is emotionally, sexually, or physically, are at a higher risk for suicide, and children who have lost a parent. So that's actually my girls. That's one of the last pictures taken with their dad, and you can't tell, but he had stage 4 colon cancer in that picture. Children who question their sexual identity or identify as being lesbian, gay, bisexual, transgender, and queer, so the LGBTQ community children, they are at a higher risk for suicide as well. So I put social media in here. I actually am a pediatric nurse practitioner by trade and did my master's project on adolescent girls and risk-taking behaviors. And when I did it, social media wasn't around. I graduated with my master's degree in 1999. And so it really wasn't a beast then, and girls didn't have social media. And their studies are really kind of unclear. There are not a lot of studies related to social media and suicide in adolescents. But we have done studies that show that adolescents who report 5 or more hours of social media use are 70% more likely to have suicidal thoughts and actions. Cyberbullying is rampant over social media. So over half of U.S. American children report that they have been bullied through social media. And the same amount report that they have bullied through social media. 1 in 3 kids have reported that they've been threatened via social media or been told things like, you should just kill yourself. And there are some fairly well-known cases of social media bullying related to suicide that I will not get into. This is a whole nother avenue. Children do report feelings of inadequacy after use of social media. In one study, the 12th grade girls had a 30% increase in the use of social media, and they were also 14% more likely to report feelings of depression, which is a known risk factor for suicide. So certainly lots of research is actually needed in this area of social media and adolescent suicide. Primary prevention measures are aimed at decreasing the number of new cases of suicide and suicide attempts. Research has shown that getting mental health care and treatment for those at risk are the most effective way to decrease the number of suicide deaths in adolescents. There are lots of different primary prevention programs. One of the ones that's been studied a lot is called Signs of Suicide Prevention, or SOS. It is a evidence-based program that is used in schools. And so that program is offered by a company called MindWise Innovations. And there are two different programs, one used for middle schoolers and one used for high schoolers. The program goals of SOS are decreasing suicide attempts and suicide through education of students about depression, education through decreasing kind of the stigma of mental health, and encouraging and stressing the importance of seeking help either for themselves or for a friend who needs help. The other part of the program, there are two parts. The other one focuses on the children or the adolescents, middle schoolers and high schoolers. The other actually focuses on school counselors and parents and educating them on how to identify those who are at risk. And what to do once they've identified them, how to develop community partnerships with, to get people the mental health care that they need. And so they have educational videos that the students are shown, and the students can role play they have role play activities such as how to help a friend, and the right and wrong way of doing that, along with students speaking to counselors. And then there's a student assessment tool that is provided as well to assess for depression and identify the student who is at risk. So there was a 2016 study of this program that found exposure to the program actually resulted in a 64% reduction of the number of self-reported suicide attempts. The study also found that adolescents in the program were more knowledgeable about mental health and were more likely to intervene on behalf of at-risk friends and actually get help from themselves. Another program are suicide hotlines, like the National Suicide Prevention Lifeline, which is actually a network of crisis centers that's open 24/7. And it's accompanied by a website as well that provides education and support. So the effectiveness of such programs for adolescents really hasn't been studied thoroughly, but a 2007 study evaluating the effectiveness of hotline and telephone crisis centers did show that individuals who are serious about suicide are reaching out to hotlines, and that there was a decrease in the number of people there was a decrease in the number of suicides among those who actually called the crisis centers. It's important to note, though, that the study that was done on the suicide hotlines really didn't account for age or race or gender, and it didn't have a control group for comparison. A third way to prevent, or primary prevention measure for adolescent suicide, is actually restricting access to firearms. And goodness, we could get into an entire, this could be an entire presentation in its own, especially with the two shootings that have just happened with y'all in Colorado and then in North Carolina. Restricting access to firearms is considered a primary prevention measure for decreasing suicide rates. Firearms in households are linked to an increased risk in death and injury. And in a 2005 case control study looked at firearms identified in events where adolescents had access to the firearm and injured themselves. And of the 106 identified as case firearms, 82 were suicide attempts with a 95% fatality rate. So by keeping guns unlocked, unloaded and locked with ammunition locked and stored separately, the risk of suicide death was reduced, or can be reduced. Secondary prevention. So the goal of secondary prevention measures is really just the prevention of additional suicide attempts and treating suicidal ideation. So kind of treating those people that we find at risk, or those people who have attempted suicide, and trying to prevent a second attempt. So the best way to do that is inpatient or hospital-based programs, and not a lot of study has been done on certain hospital programs or inpatient programs, but there has been study on medication, because most of your inpatient and hospital-based programs will have some type of medication and intensive behavioral counseling. So one study that showed for medication have been widely used to treat patients who are at an increased risk or have a history of a suicide attempt. But really, studies are kind of contradictory in the use of medication, especially selective serotonin uptake inhibitors, or SSRIs, in adolescents. So there were some black box warnings issued by the FDA for the use of SSRIs in adolescents, and actually the increase in suicidal ideations. But unfortunately, what happened was, after those warnings, we quit prescribing those medications to adolescents, and we saw an actual rise in suicide among those children. And so really, we need to do more research about which medications would be best for adolescents, and kind of pinpoint the medications that we could use with them, and determine really if a relationship exists in those, especially because secondary measures are effective when you have access to health care and a decreased access to lethal means. So another therapy that's been studied a lot is dialectical behavioral therapy, or DBT. Its effectiveness in adolescents has been studied, especially in adolescents that had at least one suicide attempt and an increase in suicidal ideation. So DBT actually focuses on education related to skills that enhance the ability to regulate emotions, the ability to tolerate stressful situations, and kind of how to create a life that the child feels is worthy of living. So in that study, participants received either individual or group support therapy. Received either DBT or individual and or group support therapy. And researchers actually found that the DBT therapy was more effective in decreasing suicide attempts and self-harm compared to those in the control group, so those that were receiving individual or group therapy. So in the group that received DBT, only 9.7% attempted suicide. So from baseline to 6 months into the study, only 9.7% had a second suicide attempt, versus 21.5% in the control group, or the group that was just receiving individual and group support therapy. It really is unclear, though, with this study if it can be applied to all adolescents, regardless of race and gender, because the majority of the 173 participants in the study were white females, which again makes sense since they're at the highest risk and they're the highest group. They're the group with the highest rates. But again, this study really just highlights the disparity related to research interventions in minorities. Tertiary prevention. The goal in tertiary prevention is to diminish suicide clusters, and clusters can be point versus mass. So point clusters usually occur in small communities and are defined as an increase in suicide above a baseline rate. Usually with adolescents, it's those who have entered into some sort of suicide pact. And then mass clusters are defined as a temporary increase in suicides across a whole population. They usually occur after some type of high-profile suicide, like a suicide by a celebrity. It's unclear what causes suicide clusters in adolescents. It's been studied some, but it's thought that adolescents who are at a higher risk are in peer groups and they hang out with one another. The period of growth and development during adolescence is a time in which peer groups' opinions and acceptance are very important. That's one of their developmental tasks, and it really has an influence over that adolescent. So if they're hanging out with each other and they're all have some suicidal ideation, obviously those kids are going to be at a much higher risk. There are recommendations for communities that experience clusters, but they're really not specific to adolescent clusters. Again, there's not a lot of research at all. And although not really researched, mental health professionals do recognize a connection between media reporting of suicide and a spike in rates. There was also an increase in interest after television programs such as 13 Reasons Why that are aired on Netflix. And researchers don't think that the series itself causes an increase in adolescent suicide. There is concern about at-risk adolescents and the risk that such programs like 13 Reasons Why pose to them. And there's actually a second season of this show coming out. And my two girls who are adolescents, they are 15 and 13, say that they are the only ones who have not watched this show. Parents who have asked me about it, I've said that I have not allowed my children to watch it because when we watch it, I want to watch it with them so that I can discuss it with them. And then the other concern is that the labeling of those who cause death by quote unquote suicide, and really that's not the case. They're not a suicide bomber or a suicide mass shooter. They're a murderer, and they should be labeled that way. And so mental health researchers are trying to educate the media on how to label and how to report news and kind of change that label of a suicide bomber. Because while, yes, they did kill themselves, they did kill many other people. And so really that's homicide. So public health implications, research is really needed. Are interventions applicable to all ages, genders, and races? So for that adolescent African-American girl, the interventions that we have, does the same apply to them? All of our interventions are really studied in white adolescent girls, and I realize that's because they have the highest rates of suicide, but also, can we apply those interventions to them? Research on medication safety, what medicines are safe to give to adolescents to help who have mental health issues and maybe need to be regulated by medicine. And then the research in social media influence, we just really have to do that. Most children have, by the age of 12, have at least one social media account that is not regulated by their parent. So 12 is really young to have a social media account, and 12-year-olds might not actually be able to abstractly think yet and think that what they're seeing is actually real, when we all know that social media, what we put on social media, sometimes we don't put the ugly, we only put the good. Support for schools, schools who don't have an SOS type program. Every school really should do that, middle and high school, and identify those children who are at high risk. Family support, so educating families on how to talk about suicide with their children, how to talk about shows like 13 Reasons Why, and why it's important that we should actually watch those shows with them and monitor social media accounts. It's not spying on your child, it's just making sure that they're okay. After school programs are great, a great way to kind of plug into these adolescents. get them involved. YMCA after school programs, Boys and Girls Clubs of America, even summer camps are all great programs to sort of get adolescents off of their social media, take those social media breaks, and really interact with friends and develop friend groups and good, strong, healthy relationships. And then again, media education, how to report suicides in the media so that it's not reported as glamorous. Changing wording. So instead of suicide bomber, it's a homicide. They committed a homicide in which they died as well. It's super important that, it's alarming that the rates have climbed so high. And really, when you look at all the ages and the years, there is a connection between the social media and the rates of suicide increasing. And we need to figure out why and how to help. And then the next 2 slides are my references. Thank you.